The genetic disorder I'm going to be discussing is Krabbe disease. I chose this disease because I was not aware or informed about how serious and heartbreaking this disease actually was, and I wanted to learn more and get myself educated. Krabbe disease is a very rare and deadly disorder. When a person has Krabbe disease, it means that their body cannot create enough galactoceramidase, also known as GALC. GALC is an enzyme that breaks down galactolipids that are heavily present in the brain. GALC is needed to make myelin. Myelin is a material the body uses to surround and protect nerve fibers. Without this protection, cells in the brain will die and the nerves in the brain and other parts of the body will not work properly. In addition, Krabbe disease affects the nervous system. One can develop Krabbe disease if both parents are carriers of the disease, and then each child will have a 1 in 4 chance of developing Krabbe because it is an autosomal recessive disorder. If both parents have a copy of the gene, their children will have a 25% chance of being affected, a 25% chance of neither being a carrier, and a 50% chance of being an unaffected carrier, just like the parents. This is shown in the two pictures on this slide. This disorder usually occurs in infants between the age of 6 months, but it could occur in children between the age of 6 months and 3 years old if the child has late infantile Krabbe disease. This disorder gets its name from globoid cell leukodystrophy. This name comes from the characteristic pathology of Krabbe disease, where a specific type of cell, which is called the macrophage, accumulates high levels of undegraded galactoid lipids as a result of GALC activity. These cells look different from healthy cells and are referred to as globoid cells. Krabbe disease is diagnosed through a series of tests. This disease can be diagnosed by a biochemical assay that measures the GALC activity from a blood sample or skin biopsy. Other tests may include an MRI, CT, nerve conduction study, or genetic testing for mutation analysis. In the early stages of Krabbe disease, some symptoms include feeding difficulties, unexplained crying, extreme irritability, fever with no sign of infection, declines in alertness, delays in typical development milestones, muscle spasms, loss of head control, and frequent vomiting. As the disease progresses, later symptoms include seizures, loss of developmental abilities, progressive loss of hearing and sight, rigid, constricted muscles, stiff, fixed posture, and progressive loss of ability to swallow and breathe. Certain symptoms occur at different months, which is shown in this graph. In addition, the state of Ohio does screen for Krabbe disease. However, usually parents could only refuse testing due to religious reasons, but parents testing for Krabbe disease can refuse for any reason. Testing for Krabbe disease involves a few drops of blood taken from the baby's heel prior to the baby leaving the hospital. This test checks for the baby's blood sample for the presence of GALC enzymes in the white blood cells. It is also recommended that the newborn screening sample be collected when the baby is between 24 and 48 hours of age. If the baby is not born in a hospital, parents will need to arrange with their midwife, medical provider, or local health department for the newborn screen to be collected after the baby is 24 hours old, but before the baby reaches 5 days of age. The chromosome that is involved with Krabbe disease is located on chromosome 14. This disorder is caused by a gene mutation. The type of gene mutation is referred to as GALC gene mutation. Krabbe disease is not very common and is said to be very rare. Crab disease affects about 1 in every 100,000 people in the United States. It occurs most frequently in people of Scandinavian descent. Crab disease is not gender specific, and both genders are affected just as much as the other. When living with crab disease, the life expectancy is not more than 2 years of age. There are in fact a few treatments or therapy options for crab disease. Individuals affected by crab disease who are diagnosed before the disease is too far progressed may be eligible for an umbilical cord blood or bone marrow transplant. Through this procedure, stem cells from donated umbilical cord blood or bone marrow containing normal cells of the GALC enzyme are given to the patient to stop the progression of the disease. However, this treatment does not repair myelin that has already been damaged. A couple of therapy options are genetic therapy and stem cell therapy. With genetic therapy, the deficient gene, which is GALC, is delivered in a harmless virus. And with stem cell therapy, it can provide healthy cells with GALC activity to allow for remyelination. However, none of these options have been tested on human subjects. There are a couple clinical trials going on for crab disease, but there are charities to fund research. A popular charity is called Hunter's Hope. The only medical advancements for crab disease is proactive, comprehensive medical care to help ease pain and suffering. Crab disease is a devastating genetic disorder that will hopefully have a cure one day. Thank you.